Okay, so I'll just speak very briefly, kind of, now that you know all of the background, a little bit about what ketamine therapy kind of looks like on a process level, kind of how we actually physically do it. So, like I said, I am an emergency medicine physician. The clinicians that are running the clinics are either going to be emergency medicine trained or anesthesiology trained. And the reason both of those specialties are involved in ketamine treatment is because we are really the only people that are very experienced in using ketamine. So the way that I kind of got into giving patients ketamine treatment was that I have been using ketamine for over 7 years now. We use it every single day in the emergency department. We use it every day in the operating room in the hospital. And so I was very familiar with ketamine and what it was and how it works and what it can treat. Ketamine, when you think of it as an actual medicine in itself, the effect that you get is really based on the dose that you give it at. So if you're giving it at a very low dose, it can be used in the emergency room for patients that are experiencing acute pain, and that helps really well. When you talk about moving towards more of a moderate dose, that's the dose that we're using in the clinic to help treat depression and chronic pain. As you get into a higher dose, that's the dose you're using where you get more of the sedative effects, and we can use it for sedation and use it in the operating room. So really, ketamine is extremely safe, well tolerated, and think of it as the more you give, you're going to have different effects. And so really with ketamine-assisted psychotherapy, we're targeting that kind of middle of the line dose. People will ask, how do patients find us? So there's two main ways where people will find us. There'll be people in the community that have heard about ketamine treatment and they want to learn more, and so they go on Google or they just search for clinics, and they can actually come to us. And what happens is, us as medical doctors, we don't need a referral, we don't need a prescription. We take you on kind of as a patient. We do a full consultation, medical screening, talking to you, deciding if we think ketamine treatment would be helpful. Sometimes it's not for people that we talk to, and so we can provide that service, that consultation. So people will kind of come to us, but also people can come to us as being referred. So people that are in the mental health space that are helping their patients through therapy and really kind of like Maria said, thinking, man, they just need that extra step, that extra boost to kind of get them there. And so people in the community will refer to us. And so and primary care doctors as well will do the same. So that's kind of how our patients are coming to us or any other clinic kind of in the area. So there's two types of patients that we end up treating. And it's very interesting because a lot of what Maria spoke about was treating patients that are treatment resistant. So patients that have been on 2, 3, even sometimes 10 antidepressants without relief or without kind of getting them to that point where they are not suicidal every day or feeling the struggles of mental health. So those are the treatment resistant patients. And in those patients, ketamine is about 80% effective. So in patients where nothing else has worked, we're helping 80% of those people, which is huge. No antidepressant can say it does that. But then the other group of patients that we're treating are actually people that come to us and say, I have depression, I have anxiety, and I don't want to be on daily medications. And I just have kind of been suffering and struggling because I don't want to take a pill every day. And so ketamine is actually really useful as a first line as well. So just keeping that in mind, it's not only for your treatment resistant, really severe depression and anxiety patients, it's also for people that don't want to be on a daily medication. A lot of these medicines, as I'm sure you all know, have some really bad side effects. There can be weight gain, sleep disturbance, nausea. People feel really bad taking them just physically sometimes, and so they don't want to be on that every day. You shouldn't have to pick between feeling bad mentally or feeling bad physically. You should be able to feel well kind of holistically and generally. So our process, and this is kind of standard through any clinic where you refer for people to get treatment, people are going to book a consultation with us. We will do a one-on-one consultation with the patients. Right now they're virtual, but sometimes we do meet patients in the clinic for consults if they request. And so we get their medical history, we talk about their treatment planning, and then what happens is they will come to the clinic 6 times in about 2 to 3 weeks. And so that phase is actually called induction. So that's the induction phase of treatment. 6 infusions over 2 to 3 weeks. Up to 4 weeks out is fine based on people's schedules. And what we always recommend at our clinic is every single patient needs to be working with a therapist, because as great as ketamine is, as perfect as it works with all of the neural pathways, it's not a silver bullet. You also need to integrate that with therapy to really get all of the effects. And so that's, the neuroplasticity about 72 hours out from your dose. So we'll recommend patients to do a treatment and then a therapy session, and then a treatment, and then a therapy session. And we kind of have like a roadmap and a schedule that we'll make for patients so that they can kind of follow that. And that's the induction phase. Then after that, patients can go into something called maintenance, which some patients might not need. So we have patients that have been treated with induction 4 or 5 months ago, and we call them regularly to check in and see how they're doing, and they're doing great. They're like, oh, we're doing great. And we're like, great, that's so great to hear. We'll check in like a month or two to see how you're doing. If you need anything, come, reach out. But a lot of people are not needing to come in for maintenance, which is amazing. Then I will say we do have some patients that are very, very severe and treatment resistant. And so we have a very proactive treatment plan that we'll create with them, where they'll go through the 6 infusion induction, and then maybe a week later or 2 weeks later, we'll schedule them for their maintenance so that we can kind of keep that process rolling for them, just because they're so severe. So every single patient's different, and we help to kind of come up with a treatment plan that we think is going to work for people. When they come in the clinic, each appointment is an hour and a half, and then the infusion will actually run for 40 minutes. I did want to just talk about a couple questions that people will generally ask me, and then of course we'll open it up for any questions that you guys might have. One question and myth: is ketamine a horse tranquilizer? Ketamine is used in veterinary medicine, but again, it's used kind of like we use it in the hospital. It's used as a sedative at a high dose. So it is used in veterinary medicine, also used in human medicine, but the effect is dose dependent. So I try to reframe it, not a horse tranquilizer, more dose dependent and used for humans and animals as well. Does insurance cover ketamine treatment? Yes and no. So we cannot bill insurance and get reimbursed for ketamine treatments for patients. What we do is we will generate a super bill for the patient, and that super bill will show the physician exam, the physician consultation, the office visit. Nowhere in there is it talking about ketamine, and people are able to submit that to their primary insurance carrier as long as it's a PPO insurance, and people are getting money reimbursed to them, which is really helpful for a lot of people to kind of help make it a little more affordable. Also, we are able to accept the flex spending accounts and the HSA accounts. Contraindications, so who cannot get ketamine? There's only a few people that it would not be safe in. Number one, if you've had it before and you've had an allergic reaction, which is very rare. Number two, if you've had a history of psychosis or history of seizures, ketamine is not safe for those patients. And then lastly, things like uncontrolled high blood pressure, uncontrolled cardiac arrhythmias. We would need all of that to be taken care of first before a patient starts. What are some of the side effects that your patients and people that you know or yourself might be experiencing while you're going through the treatment? Things like headache, maybe a little bit of nausea, maybe a little sleep disturbance. Some people will also report brain fog as kind of one of their symptoms. So we always tell people this is a very intense 2 to 3 weeks. Trust the process. We will support you through the process, and we can guide you when side effects do come up, how you can manage those. And people do really well and tolerate it very well. What are you feeling like during the infusion and after the infusion? So during the infusion, you can feel a little heavy, kind of numbness, tingling, maybe a heaviness in your chest. That's all normal. And then what other people will describe is a little bit like what Maria said. You're kind of looking at things from a bird's eye view and kind of being able to reflect on things in an emotionally disconnected state. And so you can get a little bit of what they call dissociation, where patients will report floating or soaring or flying, that kind of thing. But overall, it's a very good experience for people, and we haven't had anybody that has, negative, scary effects like that during the infusion. And a lot of it is focusing on your mindset and the setting. So when you're about to start your infusion, trying to frame your mindset, take a couple deep breaths. You're here to heal. Remember why you're here. And that really can help guide people into a very pleasant experience in the infusion. For an hour or two after the infusion, patients can feel a little kind of loopy. People don't drive after their infusions, and so people will have a support person or even a rideshare help get them home.